right, I have my sterile gloves on. We're going to do a straight catheter of a male patient. Again, I have done all of my checks. I've checked my order. I have done the initial 6, and I have prepared my straight cath kit. And that includes lubrication, a sterile cup, and my swabs. So since I'm going to empty my urine into this container, I will set these off on my table, which would be close, and I'm actually going to take my lube or my swabs and set at the bottom, and if I needed to label onto my specimen jar, they do have one. Most facilities will print off a lab sticker. So I'm going to throw those off. Here is my lube. Since the mannequins, we can't use these lubes, I will have a fellow instructor pour some over my catheter tip. Okay? Next, I am going to take my non-dominant hand. I'm going to grab around the penis, not squeezing, but you do want to firmly hold them so you have a good hold. We're going to take our first swab, and we're going to start at the meatus and go in a circular pattern. I'm not going over my sterile field. I'm going to drop my second swab, again circling around the meatus, round and around. And you will see some variations where the third one, they go straight down the center. That will work as well. And next I'm going to grab my catheter. It has been lubricated. I'm going to keep the end of it in my sterile container, and I am going to hold 2 to 3 inches from the tip. Go ahead and have them bear down, and you're going to gently slide that in. And as soon as we're in the bladder, you will see urine start to flow. If you need to go all the way to the end, you can actually grab and slide that and go in as far as you need to for urine to flow. And then you can just hold while their bladder empties into our sterile container. Okay, I have just a few drops coming out, and it's done. Now I'm going to slowly pull this out, gently, tip intact. I'm going to just move this, or you can even grab it with 2 hands, put it onto your bedside table. I will have a washcloth. I will wash them up. I will remove the supplies, and then I like to take the tip, wrap it up, grab, and just covering that, and put it in a biohazard bag. Then we would go document color, clarity, amount of our urine. Patient tolerated procedure without complaints. No grimacing noted. And they're clean. We're going to reposition them into a comfortable spot and complete our ending 4.